Hi, today we're going to talk about eliminating the frustration of filling open beds in Michigan adult foster care licensed facilities and finding placement specific to working with placement specialists. So, as we get started, I wonder if you've ever felt overwhelmed to the point of wanting to pull your hair out. Maybe you're listening because you're a newly licensed operator and you're going crazy trying to find opportunities to fill your open beds. Maybe you're a placement specialist and you want to work with AFC licensed facility owners, but they're unfamiliar to working with placement specialists and how to present their facility well. Or on the other hand, you're a seasoned AFC operator and you're frustrated with working with other agencies and you want to learn about other alternatives. No matter which case you fall within, today you're going to get answers. Hi, I'm Nadine Carlson from Care Provider Solutions, and we have learned that winging it doesn't work, but systems do. So, our goal is to help adult foster care licensed facility owners in Michigan run and operate their businesses better and open them so that they can provide better resident care and have less stress. We do that through courses, a membership, and a conference. So you may wonder, who does that person represent on the screen? Well, that would be me in 2010 when I started licensing facilities in West Michigan. I was under the impression, once I got the license, that filling the beds would be easy. Lara would publish our opening along with the community and mental health agency where we were contracted with, and we would be full in no time. How do you think that worked? Well, not very well. So let's get started. How do we eliminate the frustration of filling open beds and finding placement when we work with placement specialists? Today, we're going to focus on three things: the best practices to work with placement specialists, how to present an AFC well to fill your beds quicker in Michigan, and how to find homes with the open beds. So let's get started with the best practices to work with a placement specialist. Just like when I figured out that Lara and Community and Mental Health were not promoting our opening, I was fortunate enough to meet Sandy Wake from Care Patrol and her team. Different than Community and Mental Health clients, they helped me understand about a population that was paying out of their pocket and who were primarily over the age of 55. They would bring potential clients to our facility that could potentially be a good fit in exchange for a commission. This is great, I thought. It's kind of like having a marketing department without having to pay a salary. Payment is only made once the placement is secured. I wondered and learned as we started working together what are the best practices when working with a placement specialist. So, number one, you want to review and sign the placement specialist's contract of terms. How much are you expected to pay once placement is secured? What are the special circumstances if a person passes or moves out before the first 30 days? Remember, renegotiating terms after a tour or when a placement is about to happen is not good business practice and breaks down trust. Any renegotiation should be done before that contract is signed. Secondly, you want to provide information about your facility for better placement and for more opportunities to tour individuals. A website and social media presence are absolutely critical. They should be current and reflect exactly the type of person that you can serve well. Of course, you want to offer a tour of the facility so that they can see it face to face and get excited about bringing people for you to consider for placement. Secondly, you want to have a rate of care sheet available to give them. A rate of care sheet describes how much a person could be expected to pay based on the level of care that you're providing them. Also, provide them with a flyer. The flyer should represent what makes your facility stand out and represent your company well with good pictures of what you do. Next, you want to communicate well. Respond to emails and calls, even if your beds are full. That's the key to continuing referrals and for when you need them if a bed opening happens to come available. And as it relates to the placement specialist, provide feedback from the tour for the AFC operator so that they know whether or not to expect that the person is going to move in. Next, how do we present that AFC well to fill those open beds? Well, always be tour ready. Now, this is easier when you're just getting started, but once you're open and relying on staff to provide care, make sure you're communicating with that staff when a tour is coming so the home looks great. There's nothing worse than a person coming all excited to see what you have to offer, and the person doesn't even know that they're coming. Or you show them into the house and bring them to the room that they will be staying in and the bed's unmade. That's a poor representation of your company and certainly is not welcoming. Post the activity list. Most definitely, people are going to want to know what they can expect to do on a day-to-day basis and what activities that you offer. Post the menu. They say that the key to a person's heart is through the stomach, and it most definitely applies in the adult foster care space as well. Post that menu so they can see what type of food you serve at breakfast, lunch, and dinner, and during your snack times. Now remember, placement specialists aren't just bringing people to your facility, they will be showing other options as well. So help that person remember who you are by providing them a goodie bag after their tour, along with the flyer and the next steps if they decide they want to move in. Now remember also that this is not one-sided. A person is coming there to see if they like you, and it's your responsibility to make sure that you and your staff are capable of providing good care to that individual. So assess the resident while they're there to find out what their needs are and whether or not you're able to meet them, and also to establish what that rate of care is going to be. Make sure that their care needs fall within your sweet spot to increase the likelihood that they are going to stay there long term. Now, where do you go to find homes with open beds? Well, typically people would go to the LARA website in Michigan, where you can type in the name of the facility and it'll show you their licensing history, whether or not they've had citations. But some people find that it's very challenging and difficult to navigate the homes with the specializations that they're looking for. Another way, and a new way that you can do it, is checking the open bed listing with Care Provider Solutions at our website, careprovidersolutions.com. In the drop-down list, you will see the open bed listing. This is available for our AFC Mastermind members that will allow you to see which facilities in Michigan has open beds. Not only do you get the contact information, but you also get to see the types of specialties that they can meet, as well as their cost, and whether or not they're private, shared rooms, wheelchair accessibility, and other special considerations for you to decide if you want to have a tour. Now that you know the homes that have openings, what happens next? Well, if you're a placement specialist or you operate an adult foster care facility in Michigan and you want to keep up to date on the tips, topics, and the strategies specific to the adult foster care space, including legal updates, sign up for our free Engage provider list by scanning the QR code on the left. For AFC operators who want to be added to the open bed listing or would like to access some of those resources we talked about, like the rate of care sheet or an example of a flyer, join our AFC Mastermind membership, where you will have the opportunity to connect, grow, and learn the information to run your business well. We look forward to supporting you. Feel free to contact us at any time.